course, what is all this hullabaloo about the HPV vaccine? Because we have seen, of course, our very own president and even the CS for Health actually, giving this a green light. But then again, we do have the Kenya Catholic Doctors Association who are calling for Kenyans to reject the vaccination. And so we're asking you this morning, do you support the HPV vaccination? And you can go as far as even telling us what you understand so far. Do you support the HPV vaccination? We are talking to Dr. Colin Stabu, the head of National Vaccine Program from the Ministry of Health. Also, Dr. Charles Muriuki, a gynecologist from MP Shah Hospital. They're still in studio. They will be back. But for now, let's catch up with Dr. Stephen Karanja, who is the chair of the Kenya Catholic Doctors Association. Welcome.
Thank you.
Okay, so you are at the center of this. And, when we saw the president rolling this out in Mombasa, Dr. Karanja, he actually said, can we please stop politicizing science? What's your take on that, by the way? Because the president actually sees you as just causing chaos for nothing. And being backward, so to speak.
I would be flattered if he was thinking about me.
Yeah.
Our president has doctors. He has no business, of course, talking about medicine. That's not his area. But if he was talking about me, I would feel flattered.
Well, not you, but basically religious leaders, so to speak. Yeah.
I'm not here as a religious leader. I am in this studio today as the chairman of the Kenya Catholic Doctors Association. The key word is doctors.
Okay.
Who happen to be Catholics and who are led by particular values. But the foundation is doctors.
Okay.
And therefore, when we talk about this, we would feel it pedestrian if anybody was to imply that there was any religion in what we are saying.
Yeah.
We like talking cold science.
Okay, because you see, there's also that confusion, and you'd understand where the general public are coming from, because when you see someone like the Mombasa Catholic Archbishop Martin Kivuva saying that, yes, we agree, we support the vaccination rollout, and then now you've got the Kenya Catholic Doctors Association, we think you're one and the same. So tell us the difference.
Every viewer needs to know about our shepherds. Just like the president, who is a politician, and our president, our bishops are just that.
Okay.
They are not the science people. And I think if they made any statement, it needs to be taken in that context.
Okay.
But when you come down to the real issues, talk to the scientists in the Catholic Church. Yes.
Now, number one, is this coming from a moral standpoint besides the science? Because there's the idea that if you as Catholics, or the church, so to speak, now you've of course clarified where you're from, but let's say the church was to endorse or agree that this vaccine should be rolled out, people say that, okay, it's like the Catholic Church supporting teenagers or preteens to be sexually active, because you're telling them it's okay, go ahead, you can still be sexually active, but here's the vaccination before you go. So it's like handing out condoms.
One would be very surprised if they were to talk with authority on matters science. Again, on matters which are very simple, like human papilloma virus and its vaccine, without getting proper questioning and guidance from the people of science amongst them.
Yeah, but now from a moral perspective, what's your take on that? Is that why the church would also be against it? Because
I would say that the moral position, and there is really nothing immoral in anything.
Okay.
Everything has always that issue. Is it moral? Is it not? Even science itself. There is always that question, is it moral or not? But let us come to the issue, which is the HPV.
Right.
What is HPV? HPV is an infection that has been around for more than 100 years. It is not a new thing.
Right.
In fact, it was in 1970 that somebody actually who got a Nobel Prize for discovering the relationship between HPV and cancer and the HPV and cancer of the cervix. 1970. And look at the vaccine, when the vaccine comes. 2006. Before this was discovered in 1970, HPV was always there.
Okay.
Number two, before 1970, because cancer of the cervix was still ravaging the world, other countries that have proper preparation, proper organizational structures in their ministries of health had already tamed cancer of the cervix.
So what is the issue that you feel we are missing out on here?
We are missing out on one issue.
What?
Number one, hyping something that is not very useful and refusing to use the national resources available to deal with the real issues.
Okay.
The real issue is that 9 Kenyans are dying from cancer of the cervix. In this country every day. That must never happen. It is, in fact, a show of extreme irresponsibility that this is happening now, when in other countries of the world, using simple things,
like what?
Like screening of women, that they were able to protect their women. 9 women dying in this country, 9 mothers, 9 sisters, 9 wives, every day is a grave measure of social irresponsibility by 2 people, the government, number 2, the Ministry of Health. And therefore, one feels extremely annoyed by a government which sleeps on its responsibility, by a ministry that's absolutely irrelevant in issues of women dying of cancer of the cervix. In fact, even these ones dying, they are dying because the government has not put its structures to treat those who are found with it.
Okay. So number one, you're concerned about the quick rollout that has suddenly just showed up at our doorstep.
Even before they informed the public. Now that's why you are seeing the ministry all over every media house. They should have done this for 1 year before they rolled it out. But this, I would have been very shocked. This is characteristic and standard for the Ministry of Health.
And tying that, I'm just going to read out a little bit of what you actually sent to the newsrooms, because as KCDA, you did give your position on the vaccination. And listen to this. The vaccine industry also has very many people on its payroll, which includes scientists involved in vaccine research and development, SRHR advocates, MOH staff, Global Advisory Committee of Vaccine Safety, blah, blah, blah. So what you're simply saying is that, by the way, there is also money to be made in this industry. Not
even little money. HPV vaccine, Gardasil, 4, there is now a bigger one, Gardasil 9, which is not even available here before you buy the Gardasil 4, because if we were thinking about anything else, we would have brought Gardasil 9. Which covers more of the 16 viruses.
So what we are at right now is 4, and 9 is already out.
It has been there. Why not bring 9 if they were worried about dealing at least with the known 16?
So this is a way. This is a money-making scheme.
It is a money-making scheme, and it is good to hinge this on something more scientific.
Okay.
Number one, whether you vaccinate somebody or not, and whether they even become infected or not, 99.85 the WHO says of those who develop this infection, the normal body immunity will remove it. You remain with 0.15.
And this is proven. This is scientific.
That is World Health Speaking. Not even anybody in this country.
This is not Karanja talking.
This is not Karanja. This is not even the Ministry of Health. This is WHO speaking. 0.15. These are the people who, because of negligence, turn up into the 4,000-5,000 Kenyan women who are diagnosed with cancer every now. If over 99% of the infection is removed naturally by the normal immunity. How much money to waste do you have that you can't deal with it from primary prevention rather than get the country to spend so much money when people who have cancer, nobody is taking care of them, and number two, nobody is screening them. If you do not do that, then you become a firefighter. And it is therefore not only immoral, but we think irresponsible for anybody to hype up something that can be removed by the immunity of the body. Something that has been destroyed, stopped, eradicated nearly by other countries even before vaccination was there. And we have refused to do the common sense things that other countries did. Screening women, taking care of women, putting more resources in the care of those women who have things. You go to Kenyatta Hospital and it is pathetic. Our ladies are moving with this cancer everywhere, but nobody to treat them. Why can't the money being put in this vaccine, which is not useful, if 99% of the people infected by HPV, it will be removed by the natural immunity. Why do you want to take the money, the little money in this country, and take it to vaccination rather than taking it to cancer treatment and screening? Are you honest?
Do you agree with Dr. Karanja on that? Let us know. We still do have more vox pops, at least opinions concerning this HPV vaccination. Thank you so much, Dr. Karanja, for that. We've had your point. Let's listen to what Kenyans had to say concerning the HPV vaccine.
So I'm very happy because watakuwa prevented kwa hiyo cervical cancer. Na itazidi kusaidia watoto wengi sana wasipate ugonjwa. Nimefurahi sana.
Mimi nafurahia kwa hii mradi ya serikali ambayo imeleta HPV vaccine. Kwa maoni yangu mimi najua kuwa hii itasaidia watu wetu, haswa wakaaji wa Kisumu. Hii itasaidia sana na inapunguza hii ugonjwa ambao inatuadhiri kabisa, ugonjwa wa kansa, na hata kwa watoto wetu ambao wako chini ya miaka 10. Napongeza serikali sana na itasaidia sana sana.
I've heard about this HPV, the vaccine. It's a new one, and I think it's good, mainly because for a long time cervical cancer has been a challenge to our girls. So this is a bold move because now this means in the next generation cervical cancer will be a thing of the past. So in my opinion, I think it's a good thing, and I hope that in future there'll be advancements in medicine so that we can get more vaccines in other serious illnesses, just like it has been done.
My feeling is that we do this thing in piecemeal. We do it in a smaller fraction and observe, because we don't know what will. It might be. What I can say that it might be dangerous. It might be bad and mercy.
Mi maoni yangu ningependa kusema ndio wanasema wana vaccine watoto wale below 10 wasipatane na kansa. Lakini mimi bado nauliza, kwa nini hizo vitu zikisemwa vaccine zinaletwa, lakini bado unapata hizo vitu bado zinaenea na zinaendelea.
Hii HPV naona kama ni mzuri sana kwa venye ile introduciwa, ni idea mzuri sana, ni idea poa sana, na kenye sijui ya kwamba ni kama naweza uliza kidogo kama kuna effect kwa hizi, kwa sababu nasikia kama kuna watu wanalia sehemu tofauti, mara kuna shida fulani, mara kuna shida fulani. So nataka mtuelezee tu kama kuna shida, na kama iko na shida na ingekuwa mzuri sana mjaribu kwa vitu zingine kama experiment, tuone hii kitu inafanyika aje. Juu kwa sasa tunaweza sema ni mzuri, lakini pande nyingine sio mzuri.
Okay, and so there you have it. Just opinions on the streets of Kisumu in regards to the HPV vaccination. We're just talking to Dr. Karanja before we actually showed you some of those opinions from Kenyans. And right now we are back to Dr. Tabu and Dr. Muriuki. You've heard what Dr. has actually said. And the big question here is, why are we spending all this money on this rollout vaccine when he talks about the body having this natural immunity? And he even said this, in regards to what he had sent out as a presser, and says, after going through scientific literature on vaccines, listen to this natural immune system that we have is able to clear over 95% of all HPV infections in 2 years without any intervention whatsoever. I think this lies in your docket, Dr. Tabu. Why are we rolling this out?
Thank you, Shiko. I would just like to state categorically, without fear of contradiction, that it is cheaper to prevent by far than to treat. It will cost the government of Kenya approximately 450 shillings to vaccinate a girl with HPV vaccine. In the private sector, it costs 10,000 shillings.
Yeah.
But this is far less compared to the about 1 million shillings you'd spend taking care of a cervical cancer patient. This not considering that this person will lose their income.
Okay.
This not considering the emotional and physical strain, the lifestyle changes that this person has to go through.
Yeah.
If you have had to go through this process, then we wouldn't even be having this discussion. If it were true, then that the body's natural immunity is able to clear HPV infection, and then probably clear cervical cancer, why are we here then today? Why are we having people die from cervical cancer? It's actually irresponsible for us to watch them die rather than do something.
Okay.
And just lastly to say,
Yeah.
the cervical cancer is often picked up late because it's in the reproductive organs, which does not present quite early. By the time the women present with cervical cancer, it's a bit very late. So it's not enough. It's a bit irresponsible to say these women are careless to have been diagnosed late. Really, it is almost like an insult.
Okay.
And just thinking that people have been bribed to bring the vaccine to the world, I'm not too sure. It's a bit irresponsible.
Well, with all these exposés going on in pharmaceutical companies
I'm not sure,
being caught out.
sure there's a pharmaceutical company that has enough muscle to bribe 115 countries, including the whole of Europe.
Okay, listen to Emmanuel Mwakera, who goes on to say, my question is HPV really a priority now in the fight against cancer? Is it the only solution to cervical cancer? If not, is it the most viable option? What of those who already are victims of cervical cancer? What happens to them?
Let me just expound on something. And I probably would emphasize this, that yes, the vaccine, it's almost like saying you have a fire. You want to put out a fire. Okay, you can use a fire extinguisher, but if the fire extinguisher is not enough, you need to look for something else. Okay? The truth of the matter is it will take years before the effect of the vaccine is seen.
Well, we're seeing this in Australia.
Yes, and the reason is that's questionable because the vaccine is being given to young girls before they're sexually active. So before you actually see that effect, it'll take some while. I probably would reiterate that we are not just saying the vaccine is the only approach.
Right.
I probably need to emphasize that it's a complementary action, and I will also reiterate that the best and the most important strategy that probably the Ministry of Health would use is cervical cancer screening. Unfortunately, in our country, we are performing dismally low, at around 15 to 20% uptake. And this is something that we need to focus on because that is what would be the immediate probably approach to trying to reduce these new cancer cases.
Right.
As we potentially reduce the effect in the years to come with the vaccine. And probably that is where I emphasize that the ministry probably needs to put much weight on as they roll out the vaccine.
Okay. So even as we say goodbye, Dr. Tabu, then what we're going to ask is what's the government's plan then in terms of sensitizing? And what we're talking about, why are we not seeing it in our faces? Go for early screening. Go for early screening. It needs to be in our faces every single day.
It is there. There is a whole mechanism in place to sensitize. One, we have had great support from the sensitization that we have had with the churches, the Catholic Church, our Muslim colleagues, our Protestant colleagues. We brought on board all the county governments, the supportive council of governors. We brought on board other allied ministry departments. We have had civil society organizations with us and all that. The messaging is now out there. As we roll out the vaccine, you will see a lot more of it, and especially emphasizing that the government is looking at the vaccine as a complementary measure towards to the other two existing preventive measures, which is screening and which is early treatment. So we aim to reach at least 90% of the girls with the vaccine and aim to have at least 70% of the women between 35 to 45 years of age get screened, and aim to have 90% of the people who are picked up with precancerous lesions or cancer access treatment. So that is a strategy the country has towards cancer elimination, which we hope to have.
And of course, the discussion continues. It doesn't end there. Of course, still lots of questions coming through our social media platforms. But thank you so much for those. We'll definitely be able to respond and even share them, of course, with our professionals here on set with us. But even as we wind things down, I want to say a big thank you to Dr. Collins Tabu, who is the head of the National Vaccine Program from the Ministry of Health. A big thank you to Dr. Charles Muriuki from MP Shah Hospital, and of course not forgetting Dr. Stephen Karanja, who is the chair of the Kenya Catholic Doctors Association. Do you support the HPV vaccination? That has been our question to you this morning. Whichever way you slice it, we sure hope that we've given you enough to make an informed decision. My name is Shiko Kaitani, and on behalf of my co-hosts Jeff Mote, Paul Mungalambuvi, and the entire team from K24 This Morning, thanks a lot for watching. We'll see you bright and early from 6 a.m. right here on K24.